I'm excited to talk about the Informed project. I think it's a really good example both of the kind of project that we're interested in at Bellberry, but also the capability of a group like CTIQ. Bellberry has two simple objectives. The first is to protect the welfare of human research participants, and the second objective is to improve the quality, efficiency and effectiveness of research. So Bellberry was interested in a collaboration like CTIQ because this is a collaboration of groups, organisations, people who are similarly interested in how do we drive continuous improvement in clinical trials. Informed is a really good example of the type of work that can be done through the collective effort of similarly interested stakeholders. We were thrilled to see the national adoption of Informed, and we also think that's really good recognition of one of the things that we think makes CTIQ a success. CTIQ and the work that is undertaken by CTIQ is by its very nature a cross-sector, nationwide collaboration of stakeholders from across all settings in the research sector.
Some of the success of the Informed template, I think, is timing. We developed it at a moment in time where there was a broad push for templates that were shorter, more accessible and more consumer friendly. People were realising increasingly how important this was to the integrity of the health and medical research sector. But we also had a lot of people involved with developing the templates that acted as project ambassadors.
It was so nice working with diverse people from across the sector. I felt that was one of the best things about the project, just getting actual people from the sector together to develop something for the sector to use is like a really unique experience. Often things are developed by, an institution or a government or something. So it was so great to be part of that process and a whole group of really passionate people.
I'm lucky enough to have been working in clinical trials my whole career, and when I started my career, you put together a fairly short piece of paper that genuinely let somebody know what they were going to be doing. And in the intervening years, it did really swell to a document that was trying to be everything for everybody. And I believe the Informed template has brought us back to where we should be, which is this document will give, it's an information sheet. It is a sheet providing you with the information that you will need to make a decision, and has also, it's a bit more robust than what we were doing 30, 40 years ago in the ways that everything is more robust than what we were doing 30 and 40 years ago.
The Informed PICF story is about the maturing of the Australian research sector with regards to jurisdiction. So that's the National Mutual Acceptance Platform and those state-based groups. There was a national health reform that really kicked off in 2016, which compelled health services and research institutions to create an environment where it's easier to do things better. And so that really helped pave the way for the Informed PICF to gain traction and develop that trust with a broader group of stakeholders. In South Australia, we had the opportunity to be early adopters with some of these tools. The uptake there was really strong because the researchers themselves, they have a scientific mindset. They're looking for iterative improvements, and this is one way to consider participant experience, recruitment, and to really optimise their systems as they move through a study and reach their objectives.
It's a well-known problem in research that we don't always have the breadth of people take part in our research that exists in the community. So we know that research is often very time intensive, that it can take quite a lot of resources to arrange your life so that you can come to appointments and those kind of things. We are becoming more aware and more wanting to address the fact that the data that you get out of the research reflects who's in your research. So if you only have a certain type of person who's taking part in your research project, then the data that you have at the end is about that type of person, not about everyone. We want to expand the types of people who can take part in research and who want to take part in research. There's a lot in the national statement about reducing participant burden, and this is one of the ways that you can try and do that, by trying to respond to the needs of the participant. A lot of the time, participants don't feel able to ask for what they need, and the staff at a site don't necessarily feel able to respond to what they think people might need. So one of the other outputs of this project is a discussion guide to try and help site staff and participants have that discussion, so that site staff know what their options are that they can offer participants, and that they have a way of engaging with participants to respond to those needs.
There are two kind of main things that have come out of the project. One is some guidance around, defining what it is and some of the things that might be considered flexible trial delivery, and then a checklist that sites or sponsors might use to just help to guide them as to what they might consider in terms of flexible trial delivery. So I think that those two documents are going to be highly valuable for people to reference. It's not that they have to do everything from the beginning to the end, but it's just to give people ideas and thoughts and guidance around aspects of flexible trial delivery. For our organisation, it will be great to have something that that provides that place to go to think about flexible trial delivery. We're already doing it for lots of our trials. For the START trial, where we came up with an innovative way of developing prescriptions, and because study drug is being delivered to participants' homes, and so we came up with a way round kind of making sure that we could sort of fulfill the pharmacy guidelines, but also be able to do the trial in the most efficient way possible. So I think really what's going to be useful is that was developed in the context of one trial, but being able to share that example and the case studies that CTIQ are developing to sort of bring it to life a bit, where people and groups and teams can see that actually it isn't that all or nothing. It is, you might have one aspect of your trial that is flexible and everything else is fairly traditional, but just helping people to really think a bit more innovatively around how they design and deliver trials.
Really good for investigator-initiated projects where they're like, hey, we want to do this study. How do we get the full patient pool of this? You want to have results that are generalisable to the general public, not just to what your metro areas look like, but it also gives them things to think about. what hurdles other people have gone through, what barriers they might have come up with, and how those barriers were then sort of broken down, and what you can do to really get the study happening. It means that you're not trying to reinvent the wheel or starting from scratch, and all of that initial groundwork that people do when they're trying to set up a study, it's been done. And you can just sit down there with the checklist and go, okay, cool, we want to do that, we want to do that, and just systematically work through it. It means then that when it goes to an ethics committee, you can demonstrate that you've used a toolkit, the study's feasible, they don't have any questions about the setup or the design or whether or not patients will be impacted from participating in this study, because that's always an issue, is are you going to overburden them? And you can recruit quicker. So for the project that I worked on, when we kept it very Sydney-centric, very hospital-centric, we had 15 people, I think, by the time COVID came in. We quickly put a protocol amendment through for e-consent, telehealth screening, and it was originally we would go out and collect samples off doorsteps, and then it quickly shifted to they could post them back to us. We went from 15 patients to 150 patients in less than 12 months. And it also meant that our study was then generalisable, because we had participants from the city, we had participants up on Thursday Island, we had participants in Darwin, we had participants in Western New South Wales, lots of different places, because they would just pop these sample boxes, stable for 2 weeks, and off they go. Because it was so new, the ethics committee at the time was just like, what do you mean? And I'm like, well, actually, if you have a look through all the guides, it was reducing risk to patients because it was clearly a pandemic, reducing burden because they no longer had to travel, and you're increasing the scope of your research.
As far as we're aware, this is the first time that an exercise like this has been undertaken in the research ethics space in Australia, which is quite incredible when you think about it, considering how many ethics applications come through and how much research hinges on this process. So the ARDC approached CTIQ to develop this project so we can start to investigate how HREX and other ethics review bodies approach complex decision making, particularly in the context of research that involves the secondary use of data, which is an emerging space. It's becoming increasingly embedded in required research practice, but it raises all kinds of technical, legal and ethical issues in terms of the review of research.
We made up a study where data had been collected from parents who had very preterm babies, and a whole range of data had been collected, but in this case we were asking to reuse just the quality of life data relating to the parents. And it would have been individual level participant data, which is potentially, quite identifiable even once you take away names. So there are ethical issues involved there. We wanted to see how the ethics committees addressed that issue.
Our aim was to gather a snapshot of what was happening on the ground for ethics review bodies, where their challenges lay, where outcomes and approaches were approaching areas of consistency, where there was divergence and variability, how and why those kind of variations might occur, and what that means going forward for support and guidance in this space.
What we found was an astonishing array of diversity. We got a big range in outcomes, so some approved the study, some rejected it outright, and quite a number of committees asked for further information or for a number of revisions to be made. And even within those revisions and requests for further information, there was even more divergence in opinion. So there were a number of themes that came up repeatedly, but while some committees were very positive about the way that the application had been written, others were very negative.
My expectation was that a lot of people would ask more questions, so we purposely left some holes in there. I think once we got past the specificities of the project, everyone sort of saw the same image, that there did need to be more questions asked.
So many committees raised things about privacy and de-identification and more information about their data management plan. So those are things that we know are really important for researchers to address more clearly in their applications. But then there were a huge range of issues that were raised by only one or two committees, suggesting that there's so much diversity that it might be difficult for researchers applying to multiple HRECs to get consistent advice. And that suggests that perhaps HRECs need some additional guidance and support in making their decisions as well.
The primary purpose of today is to share the findings and to open dialogue. We have a number of stakeholders from a whole range of different industries and institutions and different parts of the research life cycle all in one room, which is such a rare and exciting opportunity to have this kind of conversation, which I think anecdotally a lot of people are having in their own spaces and in their own silos, but to have it all together in one place, and particularly in the room with people who have the capacity to perhaps move the needle in areas that might be needed to move, or to shift policy, or to be able to put pressure on where supports and guidance need to be developed, is a really fantastic opportunity. We did notice institutional culture and expectations, and even just the types of research that the ethics review bodies expected to come through their committee meetings did flow through their approach to the reviews. And the purpose of today is not to flatten the ethics review space and to make sure everybody approaches and makes the exact same decisions in the exact same ways every time, because that's not the purpose. You want some localised decision making, you want cultural specificity, you want it to be relevant to the context in which the research is occurring and where the ethical discussions are happening. But at the same time, you want to make sure that everybody is approaching it within the same ethical framework, within the same understanding of the legal space, the same understanding of the national statement, particularly when we start talking about things like multi-site research and mutual acceptance of review decisions, that to make sure we're all speaking the same language and using the same grammar, so to speak, is really important.
As a group, we're all very focused on translation of our research into policy and practice, and having real impact on the research ecosystem and improving ethical review so to protect participant safety and ensure the highest quality research across Australia.